Hello Nutri subscribers, welcome back to Nutriverse Academy. So in previous episode we have talked about CVDs, role of nutrigenomics in CVDs. So today we are going to cover about hypertension, that is role of nutrigenomics in hypertension. So let's dive into the topic. So generally we'll discuss a very small topic in the hypertension which is only related to 6 marks or 4 marks answer, because the entire hypertension and CVD is linked with the only metabolic disorders, right? So you can also write some of the CVD symptoms that will link to this of hypertension also. So generally, as you know, there will be some genetic influence. We need to talk in the hypertension also. So generally there are some genetic influence like certain genes like ACE, AGT, NOS3 and APOE. So generally these type of genes will affect the blood pressure regulation, and also responses to some of the dietary factors plus response to some dietary factors. So these are some genes, certain genes that will affect the blood pressure regulation, and also it also responses to some of the dietary factors. As you know, APO gene which is responsible for the inflammation and also for the what you say lipid metabolism, right? So these are, as you know, lipid metabolism is also one cause of the hypertension, in which the blood pressure is also one cause of the CVD. So it's just an interlinked thing, right? In the heart disease or in the CVD we'll talk about hypertension also. So these are some genes you need to include in the answer. It's not the depth that what is the gene that is affecting each and every ingredient, not like that, right? So that's why I've just include certain genes. So these are certain genes, that is some of the genes. Okay, our first point is genetic influence. First you need to know hypertension. As you know, there will be the rapid increase of the blood pressure in the human body, which leads to hypertension. So and the second point is the genetic influence, which some of the certain genes like AC, AGT, NOS3 and APO. So these are the genes which mainly regulates the blood pressure and also responses to some of the dietary factors. And the third point what you will say is salt sensitivity, which is very important in the hypertension. So generally what is the salt sensitivities? Every individuals have genetic variations that make them more sensitive to high salt intake, increasing their risk of hypertension simply. So every individuals have their own salt intake ratios, right? So for example, in our family, most of the people will eat less salt, where I consume more salt, where my tongue is habituated like that, or maybe the genetic variation which I personally have. So that is the variation which we will see in the salt sensitivity. Okay, so generally each individuals have genetic variation, so which leads to salt sensitivity. So that is the third point, which because of this we are getting hypertension. And next is, as you know, we need to talk about better blood pressure control. So generally identifying genetic risk allows individuals to modify their diet lifestyle for more effective hypertension preventive and management. For this, what we have to do, we have to give a personalized diet plan. Yes or no? We need to give personalized diet plan. So I'll write here. So first, once again I'll say the first point is we need to write about hypertension, what is hypertension, and the second thing what we have to do, the genetic that is influencing the hypertension, that is ACE, AGT, NOS3, APO, which is mainly useful for the regulation of blood pressure and also responses to some dietary factors. And the third point is salt sensitivity, in which every individuals have the own genetic variation which responds to the high intake or high consumption of the salt, which directly affecting the hypertension. So, and the fourth point what we need to include is, the fourth point is we need to give a better blood pressure control. So in better blood pressure control, obviously we need to prepare personalized diet plan. Okay, personalized and customized diet plans, which is mainly based on their genetic profiles. When we are talking about nutrigenomics, that's why I'm mentioning genetic profiles. That means what is there, if some members will have allergens, which is also a genetic variation, right? So for that also we need to include. Identifying the genetic risk allows individuals to modify their diet and lifestyle. So why we are giving these personalized diet plans means mainly we are identifying their genetic risk factors. Genetic risk factors which allows them for better blood pressure control. Okay, so that is the main 4 points. And also what the nutrition is playing in the in the hypertension, which is very important. Yes or no? So the fifth point should be the conclusion through nutrition. So basically, if you are talking about the role of nutrigenomics in hypertension, means obviously there is a tip that I'll say at the end of this session. Just you follow that tip, which is overall to all the metabolic disorders, that you can connect and write easily. You can remember easily also. So I'll say that tip at the end of this session. First we'll discuss about the nutrition, the role of nutrition in hypertension. So the first thing, we have to give low sodium diet. Okay, and the second, we will prescribe DASH diet. Obviously we'll give DASH diet, and also we'll include potassium rich foods. And also will include magnesium and calcium foods. And also will include healthy fats. Okay, will include healthy fats, and also will maintain weight. So that is the point, is weight management plus hydration. So this is the role of nutrition that should be included in the hypertension. So basically we have to talk about low sodium diets, right? So in low sodium diets, what does mean by this low sodium diets? Means reducing the sodium, that is sodium control, to reduce the blood pressure in the individuals. So for that we have to avoid highly processed foods. Simply, we need to control the salt, mainly the salt sensitive individuals, and also we need to avoid high processed foods. And the next one is DASH diet. So DASH diet is nothing but dietary approach to stop hypertension. So to stop the hypertension, what the approach diets we are giving to the individuals, that describes this diet, DASH diet. So in that, what type of foods we will include means fruits, vegetables, whole grains and lean proteins. So these four magical food items, if we include in the hypertensive patients, then we can relaxes the blood pressure and also blood vessels, and also we can reduce the high blood pressure, and also we can prevent the risk of hypertension. And the third point is potassium foods. In potassium rich foods like bananas, leafy greens and oranges and beans, these type of food items generally balances the sodium. Okay, this potassium foods mainly helps in balancing the sodium levels in the human body, and also supports the blood pressure regulation. So in that case, we can obviously reduces the risk of hypertension. And the next point is magnesium and calcium. As you know, magnesium is rich in nuts, leafy greens, nuts and dark chocolates and seeds also. Yes, and calcium is mainly rich in dairy and dairy products, and obviously in green leaves. So these type of food items generally helps to support healthy blood functioning, and blood vessel functioning, and also controlling blood pressures. And the fifth point is healthy fats, that is rich in omega-3 fatty acids, and also very much rich in omega-3 fatty acids, mainly found in fatty fish, flax seeds, walnuts, which is mainly helps in reducing inflammation and also improving heart health, which is very important for lowering of the hypertension risk factors. And the sixth point is weight management. As you know, hydration and weight management is very important for to reduce or to prevent hypertension, and also which is related to the complications. If we face any complications, that we need to prevent through weight management and hydration. So that is for that we need to have a balanced diet plan or a customized diet plan. So these are the role of nutrition that is mainly useful for the hypertension patients. So yes, so I want to say the tips that you need to focus on mainly. So generally there will be some points that you have to discuss in the role of nutrigenomics in metabolic disorders. Okay, I'll say that tip here to remember of metabolic disorders. Okay, that means for CVDs, for hypertension, and for upcoming videos also, you need to maintain that type of steps to write the answer. Okay, the first one, what the disease you are discussing about, whatever the metabolic disorder, either the disease should be discussed first. Okay, either any, that means if they mentioned about CVD, role of nutrigenomics in CVD means you need to discuss CVD first. So what is this definition? I write here, any disease, any metabolic disorder, like example CVD or diabetes, or I write this type 2 or type 1 or hypertension, anything, etc. Okay, so what you have to write, you have to cover definition, symptoms plus complications, basically. Okay, and in CVDs we have types, right? So plus types. Okay, and the second point, no, enough, this much is enough. And the second point, what type of genes is influencing, that is genetic influence related to these diseases. Okay, and the third point is directly diet gene interaction. In previous episode we have talked about inflammation and control of cholesterol. For that we wrote some type of diets. For APO, if we include omega-3 fatty acids, it is very useful to reduce the inflammation, which is directly influences the prevention of the risk of CVDs, that we have talked in the CVD. Like that you need to write here. Okay. And fourth point is role of nutrition. In role of nutrition you have to write POD, principles of diet, and next is diet rich, how I explained the nutrition in hypertension, like that. And the third point is food more to be included, tell more to be included rather than avoided. So foods to be included. Okay, and the D point should be avoided. Okay, you have to write 5 included, 3 avoided. That means you have to write more included rather than avoided. Okay, so these 4 tips is very easy to remember any metabolic disorders. So if we write definition of CVD, types and symptoms and complications, the examiner will think, okay, she has some idea about what she want to discuss for nutrigenomics. If we have to include, we are talking about nutrigenomics, right? So for that we need to write compulsory the genes, certain genes or genetic influence that is related to the metabolic disorders. And the third point is diet gene interaction, means certain diets that should be included for the metabolic disorders, that should be clearly discussed here. And the fourth point is role of nutrition. So what type of nutrition, POD, what type of nutrition you want to include, which is the diet that is suitable, that is diet rich, and what type of diet should be included and avoided. So this is the basic outline to write the role of nutrigenomics in metabolic disorders. So generally this is the tip that I want to discuss at the last of the session, but I have discussed here itself. So I'll make sure only to keep this entire thing as a separate video, and also I want to keep this video in hypertension also. So you just discuss these things. Okay, so yes, so that is for today. Thank you. If you have any doubts, please comment below, and do like, share and subscribe to my YouTube channel. Thank you everyone.